12-year-old Florida boy is one of the latest victims of this season's strain of the flu. His mother says that Dylan Winnick had only been sick for a few days before his death. This makes 30 children that have now died since the beginning of flu season in October. Joining me now is Dr. Marc Siegel, professor of medicine at NYU Langone Medical Center, a Fox News contributor. Dying from the flu, 30 kids, is that a lot? It sounds, I'm a mother, it sounds like a lot.
It is a lot, and it's very early in the flu season still. And, you know, some of these cases could be prevented by realizing that there are secondary infections involved, because you can get pneumonia with the flu, you can get a bad ear infection, you can get meningitis with the flu, so doctors have to be on the lookout. With this particular 12-year-old you're talking about, it's hard to know, because sometimes the flu just gets an inflammation going. It revs up the immune system, and sometimes the flu itself can kill. Wow. And you can't always predict it.
Yeah, I mean, because a lot of people are asking, was there something else wrong with this child in particular? He looks very healthy. He's older. You know, it doesn't look like, it doesn't look like the normal scenario that ends so badly. Is the flu that strong, or maybe there were other factors we didn't know about?
The flu knocks down your immune system. The flu causes a lot of other infections like pneumonia to parade in. If you're older, the flu makes your chances of having a fatal heart attack 6 times greater. So I think people need to realize that the flu is an enabler. It's a big enabler of other diseases, and on its own, it can really knock you down as well.
So let's talk about the things you can do. We know about the flu shot. We keep hearing reports that it's only 10% effective this year.
That's actually inaccurate, and we need to put that away right away. That was in Australia, where they only vaccinate the very young and the very old. In the United States, where we try to get everybody vaccinated, even then we only succeed less than 50% of the time. When healthy people get vaccinated with this flu vaccine, it's much more effective. So we're anticipating 30% effectiveness, and that's at preventing the flu entirely, Melissa. Yeah. There's an advantage in terms of decreasing spread and decreasing severity, even if you're not in that 30%. So I say get it.
The other thing is, you say that Tamiflu underutilized. You have it right there. What should we do about that? How do you use it for people who don't know?
Tamiflu is a great antiviral drug that really decreases how severe a case of flu you get. It decreases how long you have the flu. It decreases your risk of spreading it to someone in your household who might have emphysema, who might have chronic disease, who might even be pregnant. So we should be giving it to people at high risk, and we should give it to people around those at high risk, even during pregnancy. If you're very, very close to someone that has a severe case of flu, you don't want your unborn child getting it, God forbid. You can take Tamiflu as a prophylaxis.
And you take it also if you have the flu pretty much right within the first 48 hours, right? What else should we do?
So we need to tell people that that window has recently been disproven. You can actually take it longer than that. So I don't use that as a reason not to give it. Even if it's past 48 hours. Yes, I try to diagnose it early. And yes, I can diagnose it clinically. If you're very fatigued, if you have muscle aches, if you have high fever, headache, sore throat, that's probably the flu. If you were walking around and suddenly you have to lie down, that's the flu. If you're coughing, if you're a little congested, that's probably a cold.
Okay. Dr. Marc Siegel, thank you. And wash your hands all the time. You always say that. You got to do that.
And stay hydrated, even more important, because your nose protects you against the flu.
Thank you.
Good to see you.
Thank you, Dr. Siegel.